Hello everyone, welcome to the focus series. I am Dr. Gopal Krishan Jalwal. In this video, I am going to demonstrate you that how you can perform the USG guided IV cannulation. So what is the normal course of difficult IV cannulation? So first of all, a resident doctor try to find out the good veins for the IV cannulation, and then he takes chance to put IV cannula. So if he couldn't make it, then he calls the consultant, and consultant also takes 2 or 3 pricks to put the IV cannula. But if he also couldn't make it, then he choose either external jugular vein cannulation or CVP line insertion. EJV cannulation itself is not a easy job in a obese patient, and CVP line insertion is a time consuming process. So how the USG guided IV cannulation can make a difference? What if you use the USG for IV cannulation? You find that veins are not clearly visible for insertion of a IV cannula. That is step before the step 1. Or you can use the USG after the step 1, where you find that all veins are thrombosed and it is not easy task to put the IV cannula. So using the USG guided IV cannulation, you can significantly reduce the pain caused by the multiple pricks, or you can also save the money that will be spent on the multiple cannulas or CVP line insertion. So here I am going to tell the upper limb veins anatomy that is specially relevant to the IV cannulation. So this is a ventral aspect of the arm, and this is a dorsal aspect of the arm. So when you see that at the dorsum of the hand, here there is a network of the veins. So these are the digital veins and these are the metacarpal veins. Digital veins and metacarpal veins forms a network over the dorsum of the hand, and this is also known as a dorsal venous flexus. So as we know, this is the most common site for the IV cannulation. So on the lateral side of the hand, this dorsal venous flexus drains into the cephalic vein, and on the medial side of the hand, this dorsal venous flexus drains into the basilic vein. So at the level of the cubital fossa, here you can see that cephalic and the basilic vein meets with each other by this vein. This is a medial cubital vein. So in most of the patient, you can see that medial cubital vein is a prominent vein, and you can easily access for the IV cannulation. So in the arm, the cephalic vein continue its course over the lateral aspect of the arm, and it ultimately drains into the subclavian vein, and the basilic vein continue takes its course on the medial aspect of the humerus and ultimately drain into the axillary vein. So on the palmar aspect, there are two type of venous flexus. One is the deep venous flexus and another one is the superficial venous flexus. So superficial venous flexus drains into the median antebrachial vein, and that continue over the palmar aspect of the forearm and ultimately drains into the medial cubital vein. So deep venous flexus over the palmar aspect drains into the radial vein on the lateral side and ulnar vein on the medial side. So the radial and ulnar vein continue its course along the radial artery and the ulnar artery, at the level of the cubital fossa. Here, radial artery and ulnar artery meets with each other and forms the brachial artery. And radial vein and ulnar vein also joins each other and forms the brachial vein. So the brachial vein continue its course along the brachial artery and ultimately it drains into the axillary vein. Here you can see there are two brachial veins along the brachial artery. For the USG guided IV cannulation, we have to put our probe on the medial aspect of the arm. So here you have to locate the brachial artery. So around the brachial artery you can see the brachial vein or the basilic vein. Then you have to continue follow the brachial artery till the cubital fossa, and at the level of the cubital fossa, here you can see the brachial vein, medial cubital vein and basilic vein, and you can choose one of them for the IV cannulation. Before scanning, we have to apply the tourniquet and then start the scanning from the medial aspect of the arm here. Okay, so what you will see when you place your probe on the medial aspect of the arm, you can see a compressible structure, that is the basilic vein, and just along the basilic vein you can see a pulsatile structure, that is the brachial artery, and this is a very important structure for the IV cannulation. You have to identify it on the medial aspect of the arm, and uh, if you apply the color, then you can further differentiate the brachial artery and the veins. So here we can see the two veins. One is the brachial vein, another one is the basilic vein. Now I am going to scan the brachial artery till the cubital fossa. Here, okay, till the cubital fossa. Okay, here. Patient. Okay, now in this patient we are going to perform the USG guided IV cannulation. So first we have to apply the tourniquet. So I have applied the tourniquet, and next step is aseptic precautions. Now next, before using the high frequency linear probe, we have to clean this probe using the alcohol based solution, including. So to perform the USG guided IV cannulation, we use the high frequency linear probe, and first we have to place this probe on the medial side of arm, and what you will see here, you can see a pulsatile structure, that is the brachial artery. So we have to try to locate the brachial artery on the medial aspect, because around the brachial artery you can visualize the brachial vein or basilic vein. Here you can see the few veins around the brachial artery. Then we have to scan the brachial artery till the cubital fossa. And at the cubital fossa, you should try to bring the veins most superficially because it will make the IV cannulation easy. And here you can see a compressible structure, that is the vein, and a pulsatile structure, that is the brachial artery. And you can also apply the color Doppler. Here you can see a pulsatile structure, brachial artery, and another compressible structure is a brachial vein. Here I am inserting the 20 gauge IV cannula at the angle of 30 degree. So here you can see I am advancing my cannula, visualizing the needle tip, and here you can see my needle tip in the lumen of the vein. So next step is I have to reduce my angle of cannula, and I slide my probe proximally and continue advancing the cannula and visualizing the needle tip into the lumen of vein. Here you can see my needle tip is continue in the lumen of the vein. Now I have to advance my cannula and it. Okay. Now we will attach drip. Okay. Here is another case where we inserted the USG-guided IV cannula, a 45-year-old male posted for the nephrectomy with IVC thrombus removal and had a difficult IV cannulation. Here inserting the 14 gauge IV cannula. Uh, so here you can see the tip of my IV cannula inside the lumen, and blood is coming from the cannula. Then I have to advance the cannula here. Here is another case. 60-year-old male was admitted in ICU and had generalized swelling all over his body without any visible veins. So here we are going to insert the 20 gauge IV cannula, and you can see the needle tip inside the lumen of the vein, and another structure, pulsatile structure, brachial artery, can be visualized. And here you can see the blood inside the cannula. Here is another case where we have inserted the USG-guided IV cannula. A 40-year-old male posted for the thoracic surgery and had thrombosed vein, making the IV cannulation very difficult.